Mm. Good morning, good afternoon, good evening, everybody. Today we have not one, but two published authors. So today we have Karen Hutchinson. Bear with me. Karen is an Honorary Research Fellow, the Centre of Health Resilience and Implementation Science, Australian Institute of Health Innovation at Macquarie Uni, and Central Coast Local Health District Honorary Conjoint Scholar, Central Coast Research Institute affiliate, and she's a physiotherapist. Bloody hell. Anthea, whom we all have met before because Anthea and her beautiful husband Jason came on the podcast. So Anthea is the wife and care of Jason, who's been living with MND for 8 years, and she's now a published author. Yay! So the article that's been published is called Finally in Hands I Can Trust: Perspectives on Trust in Motor Neurone Disease Care. And prior to pressing record, we were having a quite little conversation about this, which we won't go into specifically, but having trust in the people who are caring for your person is absolutely imperative. So, Karen, we'll start with you. Why did you initiate this research publication, and how are we going to translate this?
Um, so yeah, I've worked in health for many years, and so recently I was involved in a project. It was called Rural Kids GPS. So it was speaking to families who have got children with medical complexities, and we had to do what's called an implementation evaluation of this new service. And trust came out as it threaded its way through the whole evaluation. And that wasn't something we were analysing. We weren't looking at that, but it was something that came out as really important, and how people connect and engage with services, and how people will actually develop that really important relationships, and they will, and there are sort of certain cores, constructs, or like elements of trust that really stand out. And I find this really interesting. And then, having worked with people with MND and their families for many, many years, I had I was really interested to see what people's perspectives were on trust, especially when we're trying to build more integrated care, building, because there are a lot of silos, and what do people need to be able to sort of access care.
Yeah. Anthea, how did you become involved, and why did you want to become involved?
Funnily enough, Phil Camden reached out to a few of us who our partners or those living with MND have had MND for quite some time. And I had a bit of a read through the information, and I thought, yeah, I think I can help. And I already feel that trust is really important. So we have, obviously Jason has been living with MND for 8 years, and so we've definitely built those networks around trust. And I can see where those relationships that didn't have trust failed, or that we didn't have the confidence in either physicians, allied health professionals, support workers, coordinators, where that failed. And so I thought, I do believe that trust is a very important part of the process, and making sure that your loved one is cared for correctly.
So, Karen, then once you'd gathered these remarkable human beings,
Mm-hmm.
how did you progress the research?
Yeah, so I we were doing this research. So it's an international study because Dominica, she's a speech pathologist in Ireland, and I've met her and worked, before, and we were just talking, to allied health professionals, and I was talking about some of these things that I was really interested in. So we ended up, and then I said, look, I'm going to see if there's anybody in the community here that would like to talk to us. And so she looked from the Irish perspective as well, because, it's not a country specific, it's an international thing. So it was really good to sort of see how different health systems work as well. So, like it's more about the people, and if the system works as well, then that builds trust too. And so yeah, so then I sort of reached out, and the Len, we sort of sent out, we sort of put a little bit of a blurb together just to sort of see if people were interested. And you know, we had a lot of people actually contact us, but you know, one person ended up in hospital, and a couple of other people sort of contacted us just a little bit late, because this was quite a quick paper we had to do, which was you know, a bit of a barrier for some people. And we had a very short time frame to do it, and people came on board very, very quickly. So it was amazing.
From speaking with everybody, what was the overwhelming feedback that you got, and how trust does affect the care of the person with MND?
Well, from my perspective, I think having empathy
Yep.
is a key, is really is key. And competency, so that people's ability, we talk a lot about in MND space that there's a lot of people that don't know enough about MND. They don't understand MND. But if that person is really genuine and actually reaches out and finds people, and will say, I will try and find out, I will, you know, I will find people that can help, or, you know, look into it and actually do that, that is so important. The person really understands the situation. They are really honest. They go, no, I don't really know, but I will look and find, you know, what we can do. That is really, really important. And you don't have to trust everyone. But if you've got one person or two people you can trust, and it might not be the people that you often think, you know, as a physiotherapist, you know, I'd often have social work type discussions or death discussions, and I kept thinking, oh wow, this is, you know, this is not usually my role, but you know, it was obviously I was there at the right time. That was what the people wanted to talk about, and it's really important that, and you know, you feel sort of very privileged and honored that people felt that they could ask some of these questions. So I think that's the important thing, is you don't have to trust everybody, but if you've got someone that you can trust that helps you through the system, through this journey, I think that's really valuable.
We're not just talking allied health here, we're talking from the very beginning,
Oh yes.
from diagnosis through to power care in the end. And, you know, that can also include service providers such as your pharmacist.
Hmm.
I know that we had some unfortunate incidents with pharmacists, but once you find the right one, they can actually provide phenomenal care too, extending out from just dishing out the drugs. Anthea, you don't need to be specific and don't talk about what you've talked about before, but I just know that over your journey of the last 8 years, you've had real problems with service providers or allied health caring for Jason. It's also very difficult when you have people in your house a lot. They're in your private space. They're in your cocoon. And whether you like them or not, or whether you trust them or not, they're there. And so trying to separate that relationship can also be very difficult when you are unhappy, or they just don't gel, like Karen was saying
Correct.
before.
Yeah. Um, I absolutely agree with that. So something that we've learnt in our 8 year time is that don't settle. So say, let's use our agency carers, for example, is that I could tell by the fourth shift whether the person was going to cut it or not. And if they, because it's the same routine over and over and over, and it was not only showed to them in a practical sense, but I also had written it down in theory so that people could read and digest information differently. And if they had not got on board by the fourth shift, then they were not the right person to be in our environment, and I would let the agency know. The same with, say, support coordinators, for instance. So we've had two really great support coordinators and one not so great support coordinator. And you get stuck in the, is it better the devil you know. Actually, it's not. It's not better the devil you know, because they're supposed to be working for you. So you need to be able to trust that when you send an email, that action is going to be completed, or that there is going to be a follow-up, or that the time frame is going to be within a realistic period of time. So if these people are not doing the job correctly, or are not working with you, then do not stick with those people. You should move on and find new support coordinators, new support workers, new allied health professionals. It's definitely very important. MND is a quick progressing disease, although my husband has had it for quite some time. But yeah, I think I've definitely learnt through our period is that don't settle. Like, it's not worth it.
Mm-hmm.
Karen, it's giving us more arsenal in our advocacy um, playbook too, isn't it? So, because when you're thrust into this world, your head's a mess. You don't know where to go, what to do, how to do it, and I in the beginning just tended to follow, did what I was told, and it wasn't necessarily the right thing. And all of us know that we have to be advocates for ourselves. So this information is giving us further power on being able to say, hang on a minute, no, you're not doing it correctly, or you're not right, or actually, I just don't like you and I don't want you in my house, which people find very difficult to do. So what was the feedback or what was the feedback that you were getting from the people in the group around all of that too?
So having choice and control was came through very strongly, and very much the honesty that people are really honest with them. Like this is what we found, and it was really interesting. I did find in this research that some people have like two healthcare professionals, and they check out to see what this person has said and what that person has said. Now that to me highlights there is a bit of an issue, and we don't have a lot of people working in MND space. So if people are seeing two, then that there is a problem there. I think if we don't, if you haven't got that trust in that person. But also I think one of the other big things is that engagement, is being genuinely listening to what people are saying. And although, and that healthcare professional or whoever it is, maybe might not agree with your choice, it is your choice. And you can come back and do that again. But and make those choices. It might change as time goes on. But being really listened to, I think Pactel's that really hit home when I heard that someone talk about their being at diagnosis and the person kept answering the phone throughout that process. And that, to me, that is not setting a very good relationship, and it's that's such a highly emotional and, moment. What is that portraying to that person? And it's certainly not, you don't think that's going to be a relationship that's worth building, because if they can't even take the time to provide you with a diagnosis and discuss that with you. And even in appointments, if people are ringing, answering calls and jotting down notes or talking into a dictaphone, it's not good.
Well,
So,
we had that experience as well. And I know some other people here in Canberra that had that experience as well, is that going through that diagnosis process with a neurologist here who like in Jason's appointment, it was the only appointment I haven't attended. And the neurologist actually took a phone call to be a reference for someone for an interview in the middle of Jason's appointment. Like, how disgusting is that? And so we asked for a second opinion because there was no way we were going to stay with that neurologist. It's, disgusting behavior.
when we were given the news, it was at 7:30 in the morning because this particular neurologist just wanted to squeeze us in before the Christmas holidays. He told us, you have MND. We started asking questions. He stood up. He walked over to the door, he opened the door, and he said, I don't have time to talk to you now.
What is wrong with people like that? Going back to the empathy, like, come on, that you're in the wrong
Yes.
job.
So
Yeah.
Yeah.
that's
Yeah.
our fact, and then we went to Dom. But you need to, I think what you've done is highlighting the fact that we are more powerful than we think we are.
Yes.
And to use this power, we had a power care worker come to the house, and she was covered in tattoos from head to toe, totally covered in tattoos and piercings. And Robert said to me, I don't want to see her. And I said, why? He said, look at her. I said, I'm looking at her. Turned out she was the best power care supporter. The two of them fell madly in love. She wrote me cards afterwards and came to visit me afterwards. And so, you know what? Never judge a book by its cover.
Mm. Yeah.
Mm.
I
Yeah.
think you said something really important there, that they fell in love with each other. I think that is exactly what happens, is that these people who are supporting our loved ones, sometimes they're closer to them in that moment than what we are actually. And so you need to have a village that you can
Mhm.
trust to make sure that that support is always there. It's not, it just doesn't fall on you. There's a village.
Yeah.
And also, you need to be, I know for Robert, he was able to say things to her that he didn't want to say to me to upset me. So to have someone that you truly trust in your space uh, is exceedingly important. Yeah.
Yeah. And I mean, I think sort of in this paper that we talked about was that trust companion, somebody that is that person. And also sort of that maybe, there was also talk about that anchor, so that it anchors you it keeps you engaged in the health services. It keeps you engaged because without it, you are then looking for someone that you can trust to, provide you with the care and that you expect. And I think that's really important, and it is, those relationships are really key throughout the journey.
And I'm wondering if there's a correlation between better care, trust, and a better quality of life. My assumption would be yes, but I'm just guessing that. Did that come out in the conversations?
I think if people felt they were really understood, that they had the choice and control, I think they felt that they had quality care. I think that they were really felt that they were a person and looked at as a person. And I think that was really important, not looked at a statistic as somebody with MND. They were actually felt that they were actually a real person who had a life before MND, and people understood that, that they were, what their role was, and so like, or who their family are and a bit about them. That was really important, instead of sort of going, oh, I think there was a comment in the papers about, oh, you're going really well, but that person wasn't going really well in their life that they were living. But according to the objective measure that that person had done, it didn't look like they deteriorated, but they were actually less able to do stuff that they had wanted to do. So to make those sort of flippant comments can be really hurtful, and we have to really understand that that's not something that people want to be hearing.
I was speaking with an MND specialist yesterday, and we were talking about the fact that people who work solely in MND, so allied health, nurses, whomever, can become a little bit complacent when working with people with MND because they do it every day, over and over and over again. Therefore, that can also, yeah, there can be some complacency. I've seen it, but also the conversations with the carers and with the people with MND about what's happening today, what might be happening tomorrow, the progression aren't as good as they could be. Anthea.
Mhm.
Yeah, I was literally just thinking at Pactals, I listened to Peter Allcroft, and he did the scenario.
Mm-hmm.
Karen, we were sitting next to each other about uh, with Janet and Peter. They did a scenario about removing NIV in palliative
Mm-hmm.
care. And I literally was thinking, my God, why are our palliative care doctors not having these conversations with us? Like, we need to get Peter to Canberra. We need to get our palliative care doctors training. I come
Mm-hmm.
home from Pactals. Jason's not in a very good way. Like, we think it's the end. And the palliative care doctor, who we know through our MND clinic, he comes and gives, like, as a home visit and actually has one of those conversations with us. And I was like, oh my God, like this is like that full circle conversation is actually starting to happen now. And I definitely like it provided me with that trust. And like I thought, okay, I know what he knows what he's doing. He's
Yes.
definitely giving us the facts that Jason isn't well and that the symptoms are of end of life. But we had another theory of what was going on with Jason, and he was happy to oblige what that theory was.
Mm-hmm.
And so he said, but I want to give you the facts. I want to let you know that this could be the MND progressing. So he held our hand while he spoke through all of the, hard conversations. But then he also gave us hope to say, hey, let's still go down this path and see where that leads. And as it turns out, we went down the right path, and Jason has come full circle and he's getting a lot better. He obviously still has the MND, but yeah, just thinking about that conversation, like I was thinking, why are we not having these conversations? And then literally I get home and I have that conversation because of the situation we were in. And so, yeah, it has been a very interesting 2 weeks, let's say that, in those progression of milestones. And so we're in this new phase, is that we're working with the in-home palliative care. We need to start building trust with the people that we're working with, because we haven't really had, full like access to them yet. So I feel like that, we'll be in that building the relationship stage now.
For me personally, and for us, I found that they, of everybody, were the most important relationships we had.
Mm,
Mm-hmm. Mm.
There's the symptom management.
mm,
They can see what we can't see. They know. And so, to me,
Mm.
those relationships are extremely precious. So, Karen, what's the translation for this? How's it going? How are you going to spread the joy besides being published?
So it's something that we've talked about, that it would be really important. I mean, because this was a perspectives piece, so this is different. So we had no ethics. We had, like, this was people very generously, we had these conversations. Dominica and I have both been, clinicians for a long time, worked with people with MND. And, so we had that sort of background plus the research background as well. So, and, that it would be really something to explore a lot more, because we're in a world where there's a lot of change happening. And we need to build services that are more sustainable, but we need to sort of, make them more integrated. So we don't want these silos anymore. We need to be able to work together. So to do that, we need to build trust between people using the services, but also people delivering the services. So this is a really important area to make life better for people that are accessing the services as well, because then they don't have to, repeat conversations. So it is something that we would really like to look at more. But of course, with anything, there's always the funding side of things. But, the research that we're doing now on the bridging the health equity gap, I think trust might come out in some of that, because even some of the comments that people are putting into the chats there, I think this might be something we've already seen, that certain people don't speak to certain people, and so that doesn't help with building relationships. So,
Tell us
yeah.
a little bit about that next. I think I've put my hand up for that one, Anthea, have you?
Yeah, I did too. Yeah.
Give us a
So
run.
it's, yeah, so there's so there's a lot going on in this space, and I think trust is often not necessarily looked at when we're doing all these implementing change. So we've got new models of care, and we do all these evaluations. Trust is not something that is in all these frameworks that people look at. So what we're trying to do is raise awareness that this might actually be it's an important strategy when you are implementing change. So like for, the MND guidelines, we need people to trust them to be able to engage and sort of bring them into the system, like people to use them. So it's a really important thing that we need to really look at and address, and have it that it consider it as an implementation strategy. Is like relationship building is an important part of implementing new things, and actually that takes time, so it doesn't happen in a day. So there's often not enough like funding and research for that, but if we can make that more clear, then it might help with people understanding why some things fail, some things are not, taken up. So, and also, I mean, one of the big things I think it came out for me is that, we've got a lot of people, I mean, being an allied health professional, is that people don't want to work in MND because it's sad. It's sad. It's a really, so there's a student of mine that's doing death literacy with allied health professionals, because people are scared to talk about that. And you've just mentioned that, Anthea, and Jane, about how well that's done.
Yeah.
So, but also that it's okay for healthcare professionals to maybe not know everything about MND because they can't, they might not work in that area, but it's okay to ask. And there should be people that they know who to ask. And it's okay to say to people, like, that living with MND, I don't know, but I will look, so that maybe more people will be happy to engage with people with MND. Then we're building up we're building up more people and more capacity for people with MND to be looked after better, because people are not so nervous about being in that space. And I think that's just about building that trust, that trust is really important and can maybe bridge some of those gaps. That's my
I
take.
I also think, thinking back to building those relationships, I realized really early on, actually at when Jason, he was at the Forefront Clinic, that's where he was diagnosed, is that these people were going to be in our lives. And so from day one, I started saying, what's your name? What's your role? Tell me more about yourself. And literally saying we're going to be mates is what's going to
Mm,
happen, is because you need to create that bond,
mhm,
especially from a patient perspective, because it works both ways. It's not just about the allied health or the doctors or whoever providing you with information that you gain their trust. You also have to show respect and build that relationship as well. And so that could be the just general chit chat, like when you're waiting in the waiting room. How's your day been? That
mhm,
type of thing. It also could be that your like comes back to respect that and I think about this, I've had, say, friends in hospital with broken bones that they say, a doctor came in at 10 o'clock and they said that I've got to have an x-ray, and I said, who's the doctor? And they go, oh, I don't know. So you'll actually get more out of it if you say, Dr. Smith came in at 10 o'clock and told me that I need to have an x-ray at such and such. And you might not be able to actually take that information in yourself. So it's always good to have that second person there to be able to write notes or, provide that bit of detail. But you actually get more respect back from the allied health professionals, doctors, physicians, if you actually know their name when they walk in the door, or you have a bit more of an understanding of who that person is.
yeah.
Obviously your mind is like unraveling at that point in time, so not everyone has the capacity to do that, but I definitely worked out very early on is that these people, they're going to be our mates, that we
Mm,
need to walk hand in hand together to be able to make sure that Jason's care was top
mhm,
quality.
It's very good advice. And It's really important, and it goes back to the word that keeps popping into my mind whilst we're talking is community, 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 community.
Mm, mm,
Agree.
Expanding our
yeah.
care more. And yeah, we tend, not we, some of us can tend to view the medical profession as our enemy because they're the ones coming to us the whole time with the really shit news,
Mhm.
telling us things that we don't want to hear.
Agree.
But that's not the fact. The fact is that they're on our side and trying to do
Mhm.
the best that they can at that moment. Yeah.
Yeah. And
We
I
have,
think, yeah, sorry,
I was
Anthea.
just going to say, that was kind of our experience because Jason has had MND for so long with our previous OT, Jade. She used to say to Jason, have you considered a wheelie walker? Have you considered a wheelchair? And Jason would be like, no, I'm not doing that. I don't need a wheelchair yet. And it wasn't until we kind of connected the dots at about year 3 that she was actually just trying to prepare us. Like it's just those little tiny little tidbit conversations, which funnily enough, I do to Jason now. So if I need Jason to go into respite, I'll start a conversation. Oh, I might think about, popping you into respite in 4 weeks. And that's the end of the conversation. Then in a week I'll say, oh, maybe on the 5th we'll pop you like so it's just like adding that
Hmm.
so then that way they're used to the information so that when the time comes, but yeah, at about year 3, we realized that when they started making suggestions, we really needed to zone in on what that meant because what they were really trying to do is set us up for the future so that we could trial the technology or the equipment with enough time to then order and get that processed and be in our household when Jason required that equipment. Where what was happening for quite some time is that you would say he would say no, 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 no. Then he would need it, and then you would start the trialing and everything, and then 6 months later you'd finally get it. So
Yeah.
when we connected the dots, our life really did change because we were leaning into that conversation rather than being against it and fighting it.
Yeah.
And I,
Sorry, Karen. Janet
uh,
Huff podcast yesterday, and I haven't released it yet, but she's a physio as well. And
Mm.
that's the thing that she's doing through the journey of her illness is anticipating, anticipating, anticipating. And whilst this disease is a bit of a bastard because you don't know what's going to hit at what time, what did she say that wishing for the best and planning for the worst?
mhm,
Yep,
mhm.
agree.
And I think that's and as a physio, I'm on the other side of that. So we do have, suggestions and thinking about this. And but one of the things I wanted to sort of just mention is that it's the trust relationship is with the whole family. So I mean, I've had children coming up to me and say, look, can you help me with my dad, help him with a cough? Can you show me how to do that? And we then discuss, yes, are you, like he's happy with that, and we do that. And then, we've also, had, can you do something with my dad? He won't tell me where he is. He wouldn't answer his phone. He needs to answer his phone because we were all worried, like, so we've had these whole discussions, with the children as well. And, that, and then they're really feeling a part of it because they've sort of, okay, well, if your dad's in pain, maybe you could try doing this because they want to help as well. And it's lovely because I feel that, they've got a trust in me that they're, it's okay that the kids are coming up to me and asking me now, that can I, what do you think? And I think it's really important that you understand, and what you were talking about is understanding, the family and the family dynamics, who the kids are, they're popping in, who, you've got the relatives popping in, and they know about what some of the stuff that I've, going through. How's your kid? Oh, how did they go in their exams? And, and we have those discussions, and it is really, I think and we get to know you so well, what you are saying, because we're, in and out of your house all the
Absolutely.
time. And we, we try to make sure that that's not, we're not imposing. And sometimes we work as teams. So like sometimes, the physios would be going in, I'd be going in quite regularly, and then I'll be going, all right, okay, this is an issue. Well, I might just have a wee chat with, the speechy because, I'm just a bit concerned about your swallow. And then that way, then we sort of trigger, that person to come in as well, because we are seeing, and so try to reducing that overwhelming amount of people coming in. So very much working as a team. And so we've got that relationship and trust in each other as well to be able to sort of, pick things up. And also just reducing that burden on the families of people coming in all the time. So I think that sort of is something that, is, and then the families trusting that you are aware, that you will get in touch with that other person, and then, the other professional, and highlight, and it saves them then having to make that call again. So
That's actually key because I know with me, we didn't have that. So I was the gatekeeper for everybody. And that's very difficult to, when I didn't know what I was doing. So yeah, if that is the nirvana actually of care, that
Your time frame, Jane, and Robert's time frame was so short though. No wonder you didn't know what you were doing, because you would have just been like collecting information, firing, collecting, firing, collecting, firing. Like it just would have been such a full-on experience. I just think about, our first 3 months and, living in despair and, Jason crying all the time and everything like that. You wouldn't have even had time to think. So you did very, very well in the
mm,
short time frame that you had to be able to make sure that Robert was well cared for.
thank you. But thank you. People are shorter than us though too. So
Oh, I know.
if we had this nirvana of what Karen's saying, in that, you know, the health professionals knew each other, trusted each other, and could offer the seamless services, that would just be heaven on. And I know it does happen in certain areas.
yeah, yeah.
Well, I was going to say Canberra's pretty good with that. Our MND clinic and our palliative care service, they definitely work very well together. Obviously, we don't have the respiratory team, gastroenterologist, neurologists that are part of that, but as a like MND clinic and palliative care service, they're bloody amazing.
Mm.
My
Sorry.
my observation is that areas like yours, Karen, and yours, Anthea, is where it's, I'm going to say, more regional than the big cities where there are far more staff. I think, it works far better where you guys are.
Mm,
Mm. I think, and I think that it is those relationships. I mean, I do remember when I was we set up the clinic on the Central Coast, and one of the people that I interviewed, he's gone, "Ah, like you lot of you've all been here for so long, like we all trust you because you all know each other, and there wasn't a lot of us that work in the MND space." And he's and one person sort of said, "It's just like." It's so friendly. You just come in and you can just have a chat with a neurologist. There's no airs and graces. It's just,
Yeah.
you just say, chat away, and then, and we all have those discussions about, oh, what happened here, and did you go on your holiday, and that type of thing. And I think that is really really important. But as you said, a lot of people are not getting that type of experience. So it is hard for those that hear, that when you hear about the different type of experiences people have. But Jane, I just
I think
wanted to point out that your experience of how quick you had to develop trust, like that is the thing that is really critical in MND, is that it can be quick. So we need to do this better. We need to know what it is that can help people sort of navigate this, smoothly, effectively, efficiently, and still people have choice and control as they go along, as much as possible. That is, if we can get it right with MND, I think we can sort of get it right for a lot of conditions.
agree. I think from our experience within that MND community is goddamn amazing. When you are referred outside of that MND community, not so good, because they don't understand the disease, and that really does make a difference. So, I think if we could build those MND communities, whether they've been here forever or not, and people learn along the way, then I think that's a really good thing.
So there's that word community again. And I think that it's already started. What we've been talking about, the nirvana of what we want, it has started because it's being done in different clinics. and then just by the research in the article and by our conversation today. So the aim is for people with MND and their families, their carers, to empower you, and actually for allied health to have a little think about it and go, you know what? Yeah, damn, I could do that. So I'm extremely grateful for the two of you. Thank you.
Thank you.
Thank you very much for the invite.
Yeah.
And I'm looking forward to the next one. What is it called? What's the next one called?
Oh, the Bridging Health Equity Gaps, is that the one?
Health equity gaps. I've filled in my survey on that one.
Thank you very much. Very appreciative. I think it's been really wonderful to sort of speak to you both, because it's sort of really important that
No,
we get this message out.
it is. Well, we're
Agree.
doing it. All right, lovely. So I'll be talking to you on Zooms soon. And thank you for your time very, very much. And thank you for doing what you did.
Thank you.
Thank you.
Thank you very much. Have a good day. Bye.
Bye.
Bye.